Yeah, so basically, pre-exposure prophylaxis or PrEP for HIV is a combination of two antiretroviral drugs given to HIV uninfected or HIV negative individuals to prevent HIV. So you will see like various definitions of how you define people at risk for HIV infection who can be eligible for PrEP in different guidelines. For example, for Thailand, we define those who are at risk as people who have risk behaviors, not those who are in certain populations, and these are different, right? And when you say that people who are at who have risk behaviors, that include everyone regardless of their gender, regardless of their the populations or communities that they are in. And here we can say that anyone who have unprotected, I would say anyone who have condomless sex, anyone who have history of sexually transmitted infections, anyone who shared equipment, injecting equipment with other people, or those who may come asking for post-exposure prophylaxis, meaning that they have problems with using condoms. Those who we considered eligible for PrEP or having risk behaviors for PrEP. And we also have one last criteria as people who actually come in and ask for PrEP, meaning that they may not have had risk behaviors before, but they know that they will be having risk behaviors soon and come asking for PrEP. Yeah, so here you will say that you will see that we are not saying that if you are gay man, you can come for PrEP. If you are drug users, you can come for PrEP. No, we are saying that any one of you who have risk behaviors, please come in for PrEP. As mentioned, we do not use population groups in PrEP guidelines. We use risk behaviors as eligibility in PrEP guidelines. However, in terms of implementation, it is very important that you will need to know who will be like your target clients, so that you can design the service deliveries to fit their contextual lifestyles. So here in each country, you may have different key populations. In many countries in the Asia-Pacific region, right now, more than half of our new HIV cases each year are happening among men who have sex with men and transgender women. In certain countries, the proportion can be as high as like 80% of new infections now happening in men who have sex with men and transgender women. So here, it explains how each country prepare their services ready for men who have sex with men, ready for transgender women. And in a few countries where people who use drugs or who inject drugs are still the main key populations, like in Myanmar, like in Vietnam, you will see that PrEP programs are also adapting itself to be ready to provide service in a friendly and non-judgmental way to people who use drugs as well. So I would say men who have sex with men, transgender women, sex workers, and people who use or inject drugs. We can say that in real life, we have seen the effectiveness of PrEP in preventing HIV by more than 99%. And here it is true for all populations that we already mentioned, those who are at risk of HIV because of their sexual behaviors, and including those who may also have other risk of getting HIV beyond sexual risk, such as injecting risk as well. Okay, and here, when I say that we have seen this in real life setting, meaning that right now we have almost 1 million people globally who are taking oral PrEP to prevent HIV. And we have seen so far, I believe, only 7 people who failed PrEP, meaning that they are taking PrEP very correctly with high adherence and with adequate PrEP level in their body compartment, but still acquire HIV. And that can mainly be explained by they acquiring HIV, which already has developed resistance to the medication that we are now using for PrEP. And so that's like the general effectiveness of PrEP in real life. But some of you who may have read some articles around randomized control trials in PrEP in different populations, you will see like different numbers being cited. For example, among men who have sex with men, we saw an efficacy of 42% of PrEP, but that's different number because in the randomized control trials, people do not know if they are taking, if they were given placebo or they were given the oral TDF-FTC as PrEP, and they have the efficacy number from each clinical trial actually reflected the level of adherence that participants in those studies were having during the study period. So you will see that in study with high level of adherence, you will see higher efficacy number. In study where so few people had adhered to PrEP, you will see lower efficacy number. But when I mentioned that in real life, we have seen like more than 99% effectiveness, it's because these are among people who know they are taking oral TDF-FTC and they are taking this with the highest adherence that they can do in real life. Many people are looking at PrEP as an alternative strategy of HIV prevention, but I would say that in reality, in practice, we are using PrEP as part of a combination HIV prevention packages. So in the past, you may only have an options to be abstain from sex, not having sex at all to prevent HIV. You may have only condoms and lubricants to prevent you from getting HIV. But now we are adding PrEP as another options in that package that you can choose from. And people who use PrEP will probably not use PrEP for the rest of their life. And there could be certain period of their life that they feel that they're not at risk anymore. They can stop PrEP, or they can just use condoms from time to time and doesn't need to continue taking PrEP every day, for example. So this is like options that you can choose from one combination package. Many people choose to use PrEP together with condom. To enhance their confidence when having sex. Many people who cannot use condom very well already now choose PrEP as their main protective measure for in terms of HIV, and they may be able to use condoms from time to time, depending on their sexual context during that time period. So here you can see that when we say these are options for people to choose from, we actually are increasing access for people who are coming in for HIV prevention. It's very similar to family planning options. The more options you have, the higher number of women will be protected from getting unplanned pregnancy. So here, the more options you have for HIV prevention, the higher number of people who will be protected from HIV. By saying this, this is only applied to HIV infection, prevention of HIV infection. It does not apply for prevention of pregnancy or prevention of other sexually transmitted infections. So what we have to know is that when we are talking about PrEP, we are saying that for HIV prevention, PrEP now is the best prevention measure for HIV because it provides you with more than 99% protective protection compared to condoms, which only give you 70 to 90% protective effect for HIV. But if you are saying that, but then is PrEP the best measure to prevent STI? We will say, no, because PrEP only provides HIV. Condom will still be the best prevention measure for you to prevent HIV and other STIs as well as pregnancy. Yeah, that's a very good question. So as we already mentioned that if your concern is HIV, PrEP is the best prevention measure for you. But then to take PrEP, it does not mean that you can just take it by yourself. You will still need to take HIV testing to make sure that you are really HIV uninfected before you start PrEP, because there is a risk of people who already have HIV and then start PrEP to develop resistance to HIV, because as we already know, PrEP only have two antiretroviral drugs and cannot suppress or cannot treat HIV for long term. Okay, so that's one thing. And then to test regularly for other sexually transmitted infection is also another measures that will need to be part of this PrEP service. So you cannot just take PrEP without coming in regularly for HIV and STI testing. And then, as already mentioned, if you are also concerned about other sexually transmitted infections and pregnancy, then condoms and lubricants will still be the main measures for you to use together with PrEP. And then I also would say that being part of this like sexual health service, coming in regularly for checkup, it's giving you and your society the test and treat effect. So we will see people coming in more frequently for STI testing. We will identify more syphilis, more gonorrhea, more chlamydia, and we'll be able to treat those conditions, which may not become visible to our setting as a healthcare providers before we have PrEP, because these people will not come in to the service for any purpose. And at the same time, having taking PrEP will give you the opportunity to have other STI, be able to access some other vaccinations as prevention methods for other STIs, which can be prevented by vaccine. So for example, hepatitis B, which is very common in our region here, will also be screened. If you don't have immunity to hepatitis B, you will be given vaccination. Human papillomavirus, I would say, is also something that is very common among men who have sex with men and transgender women. So there is also HPV vaccination that you can be given as part of these sexual health services as well. Would answer it using our experience in Thailand, as well as experience in Vietnam and the Philippines. And I mentioned these three countries because in Asia Pacific, these are the three countries with the highest number of people accessing PrEP services so far. Not counting Australia, I would say. But here, when we're saying that these countries are the countries where we have been more successful than other countries in doing PrEP program. It does not mean that we are doing good already. Example in Thailand is that we already calculated the number of people who would need PrEP to end HIV in our country, and that's 140,000 people. Okay, 140,000 people. But over the past 6 years that we have had PrEP programs in our country, we were only able to get 10,000 people on PrEP. So it's like less than 10% of the overall people who would benefit from PrEP. And the reasons, the main reasons are challenges for people who are at risk for HIV to access clinics or hospitals to get PrEP, because these are people who are so vulnerable by their sexual identity, gender identity, their drug use status, their illegal sex work status. So it's not easy for these people to just walk into the hospital and say that I want PrEP, please give me PrEP. That's from the client side. And from the provider side, you will see that at least in Thailand, we ask, let's say, hundreds of hospitals to be the outlet of PrEP service. Only less than 30 hospitals say that they are ready to do so, because their healthcare providers may not feel comfortable enough to give drugs to people who are not infected with HIV. They are comfortable treating HIV patients, but not to give drugs to HIV, to uninfected individuals. And this causes judgmental attitudes and stigma discriminations surrounding PrEP services. So the solutions that Thailand, Vietnam, Philippines have been taken is to use what we call the key population-led health services. And this must be something you have to include in your article here, the key population-led health services, or KPLHS, which is a concept where key populations themselves, so let's say gay people, design the service that they would like to use, and then co-deliver the service. So be part of the providers in the clinic, so that they speak the same language, same gay language, same transgender language, same sex workers language. And then with this key population-led health service model, I think it has been the key facilitator of getting more and more people to come in for PrEP services. In Thailand, 70% of PrEP clients are using PrEP service through these key population-led clinics. Same to Vietnam. And I think maybe higher number in the Philippines.